What's up, everybody? Dr. Mike here, and welcome back to Z Sharif Medical Information, your go-to place for reliable and easy-to-understand health information. Today, we're diving deep into the world of vitamin D. Now, we all know vitamin D is crucial for bone health, immunity, and overall well-being. But did you know that in certain situations, taking vitamin D can actually do more harm than good? That's right, folks. There are times when you should avoid vitamin D like the plague. In this video, we'll be discussing those specific situations where vitamin D can become a potential health risk. We'll break down the science behind it in a way that's easy to grasp, so you can make informed decisions about your health. Remember, I'm not here to scare you, but to empower you with knowledge. So, if you're ready to learn when to pump the brakes on vitamin D, hit that subscribe button, smash the like button for the YouTube algorithm, and let's get right into it. First up, we have hypercalcemia, which is a fancy way of saying you have too much calcium in your blood. Now, why is this a problem? Well, high calcium levels can lead to a whole host of unpleasant symptoms like nausea, vomiting, constipation, muscle weakness, and in severe cases even confusion and heart rhythm problems. And guess what? Vitamin D actually increases calcium absorption in your gut, so if you're already dealing with high calcium levels, taking vitamin D is like adding fuel to the fire. It can make your hypercalcemia worse and increase the risk of those nasty complications. That's why it's crucial to talk to your doctor about getting your calcium levels checked, especially if you're experiencing any of those symptoms I mentioned earlier. Remember, knowledge is power, and knowing your numbers is the first step to taking control of your health. Next up, let's talk about kidney disease. Our kidneys play a vital role in filtering waste products from the blood, and when they're not functioning properly, things can get complicated. One of the things our kidneys help regulate is calcium levels. Now, remember how we talked about vitamin D increasing calcium absorption? Well, in individuals with kidney disease, this can be problematic. Their kidneys may not be able to handle the extra calcium, potentially leading to a buildup of calcium in the blood. This can increase the risk of kidney stones, which are excruciatingly painful, and other serious complications. If you have kidney disease, it's crucial to work closely with your doctor to manage your condition and determine if vitamin D supplementation is right for you. They can monitor your calcium levels and adjust your treatment plan accordingly. Our next stop is hyperparathyroidism, a condition where your parathyroid glands, those tiny glands in your neck, produce too much parathyroid hormone. Now, parathyroid hormone is responsible for regulating calcium levels in your blood, and when there's too much of it, it can lead to, you guessed it, high calcium levels. And just like with the previous conditions, vitamin D can exacerbate this problem by further increasing calcium absorption. So if you have hyperparathyroidism, it's essential to use vitamin D with caution and only under the guidance of your doctor. They may recommend monitoring your calcium levels closely or adjusting your medication to manage both conditions effectively. Chapter 4. Sarcoidosis. When vitamin D can fuel the fire. Let's talk about sarcoidosis, a condition that causes small patches of inflammation called granulomas to form in various organs, most commonly the lungs and lymph nodes. Now, what makes sarcoidosis tricky in the context of vitamin D is that these granulomas can sometimes produce an enzyme that converts vitamin D into its active form. This means that even if you're not taking vitamin D supplements, your body might be producing more of the active form, potentially leading to high calcium levels. So, if you have sarcoidosis, it's crucial to be aware of this potential complication and discuss it with your doctor. They may recommend regular monitoring of your calcium levels, especially if you're experiencing any symptoms of hypercalcemia. Chapter 5. Now, let's move on to medications. Certain medications can interact with vitamin D, either increasing or decreasing its absorption, or affecting how it's metabolized in your body. For example, some medications like digoxin, which is used to treat heart conditions, can increase the risk of hypercalcemia when taken with vitamin D. On the other hand, some medications like certain seizure medications can interfere with vitamin D absorption, potentially leading to a deficiency. It's like a delicate balancing act, and that's why it's crucial to tell your doctor about all the medications you're taking, including over-the-counter drugs and supplements, to avoid any potential interactions. They can help you navigate these interactions and ensure you're getting the right balance of medications and nutrients. Chapter 6. You know the saying, too much of a good thing can be bad for you? Well, that definitely applies to vitamin D. While vitamin D is essential for our health, getting too much of it can lead to a condition called hypervitaminosis D. This occurs when you have excessively high levels of vitamin D in your blood, usually due to taking very high doses of vitamin D supplements for a prolonged period. Symptoms of hypervitaminosis D can range from mild, like nausea and vomiting, to severe, like kidney damage and heart rhythm problems. It's important to note that hypervitaminosis D is rare, and usually occurs with excessive supplementation, not from sun exposure or dietary sources. Always stick to the recommended dosage of vitamin D supplements and consult your doctor before taking high doses. Chapter 7. Finally, let's touch upon conditions affecting calcium metabolism. Our bodies rely on a complex interplay of hormones and nutrients, including vitamin D, to maintain healthy calcium levels. However, certain conditions can disrupt this delicate balance, making it tricky to determine the right approach to vitamin D supplementation. For instance, individuals with osteoporosis, a condition that weakens bones, may need vitamin D to improve calcium absorption and bone density. However, it's crucial to monitor calcium levels closely in these cases, as excessive vitamin D could lead to hypercalcemia. Similarly, individuals with renal osteodystrophy, a bone disease that often accompanies kidney disease, may also require vitamin D supplementation, but careful monitoring of calcium levels is paramount. That's it for today's video on when to avoid vitamin D. Remember, vitamin D is generally beneficial for our health, but in certain situations it can pose potential risks. Always consult your doctor before starting any new supplements, including vitamin D, especially if you have any underlying health conditions or are taking medications. They can help you determine the right dosage, monitor your levels, and ensure you're getting the benefits of vitamin D without any unwanted side effects. Thanks for tuning in, and don't forget to subscribe to Z Sharif Medical Information for more informative videos on all things health.